The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Tonight on Health Connections, we will be talking about lesser-known mental health services in our area. Stay tuned. You're watching Health Connections. Tonight we'll be talking about lesser-known mental health services in our area. We have with us Gary Corcoran, owner of Quality Case Management and Quality Community Services, Ann Regner, adult mental health practitioner, and Tessa Bucknell, mental health case manager and mental health practitioner. We have a lot of exciting things to talk about tonight regarding these services in our area. First of all, I'd like to ask you, Gary, as the owner of these two wonderful services, tell us a little bit about what the difference between quality case management and quality community services.
Quality case management is one of our corporations that deals pretty much exclusively with individuals in the community in need of mental health services. Quality community services we set up as a mainly residential provider of services. Under that we have a West Park Board and Lodge, the 204 House, which is adult foster care, and most recently Reflections, which is an assisted living facility.
Okay. And Tessa, let's start with you. Which of those groups do you work with?
I actually work as a case manager and arms worker for adults with mental illness.
Okay, and tell us a little bit about that. How do they reach you? How does an individual come to the point where they realize they need a case manager, and how do they reach you?
Okay, well, first of all, usually there'll be a problem in a person's life. Let's say that things aren't going very well. The family might notice that there's a mental health problem. They're not getting out of bed. They may be experiencing a lot of depression. Or hearing voices or something where the family they might not be functioning as well as they used to. So the client may enter a hospital for seeking help from a psychiatrist, or there might be an emergency or crisis at that time where a social worker will refer them out to the county to say, we need to get you some extra support and services through either, let's say, adult mental health case management or armed services that can provide that extra day-to-day support in the community, just to get them connected, to get them back to functioning where they were before.
Okay. And so once you see a client, where do you see them? Do you see them in their homes? Do you see them in a residential facility? Where do you generally work with them?
It all depends. As a case manager, my first initial visit will usually be in a hospital. Where they've really entered a crisis mode and they need a case manager to step in to get them back to functioning. But a lot of the times we'll be in their homes if they're still living at home, or a board and lodge or adult foster care. But usually it's usually in a hospital at first for case management, and in arms it's usually in a home where they're living.
Okay, and once you set up a program or a rehabilitative process for them to follow, how are you ensured that they are going to follow this process? What's their next step after they leave the hospital or perhaps leave their environment? Where do they go? What do you recommend? Well,
usually we'll set up, as far as case management goes, I'll meet with them in the hospital. We'll set up a plan of kind of where they're going to live, get them support as far as home services go. Let's say they're just not able to live on their own yet. They might enter a treatment center, and then from there, then a goal could be living independently again. But as far as ARMS goes, we usually do what's called an individual treatment plan, and we'll set goals with the client. It's client-based and goal-driven. So their goals might be just to get a job, and we'll help them with building skills, interview skills, filling out an appropriate application. We'll get them connected to the community.
And you work with ARMS, and what other types of cases do you work with, or what other types of persons, if they don't fall under the adult mental health rehabilitative services? What other cases do you work with?
Well, all of our cases are adults with mental illness.
Okay.
It can be quite specific. I may have a client who's only strictly case management, or I might have a client that's only needs ARMS. They might not need the services of a case manager.
Okay.
It just depends on the seriousness of the case.
If I can interject here
Sure.
a little bit, for case management, the criteria that has been established by the state has been that the individual has a serious and persistent mental illness.
Mm-hmm. Okay.
And then that has certain criteria in itself, and that would be determined by a mental health professional. Quite often that means the individual has been hospitalized probably more than once, probably has a major mental illness, schizophrenia, bipolar. For ARMS, which I don't know if we've clarified that acronym yet, but it's Adult Rehabilitative Mental Health Services. For that, the requirement is less than it is for case management.
Yep.
It can be just a serious mental illness wherein the individual would have three medically determined needs is the criteria for ARMS. So I just thought
so
I
it's less
better
of
clarify.
Thank you.
that.
No, that was
Yeah.
great.
Yeah.
And Anne, now once they see Tessa and they've developed a plan, then they come to you. Is that correct?
Right.
Okay. And what do you do?
Okay, they may have a case manager that I know or that I don't know, and what they'll do is I'll get a referral usually, and then I contact them and have an initial meeting. And what we do is called a functional assessment first to determine where their needs are, and that's where you come up with the three areas that are serious enough that they need services. And the functional assessment really determines how much help they really need and where their needs are and where their strengths are as well. And once we've done that, we meet with them again to develop the goals, and every client is asked to come up with their own vision goal that we focus our entire treatment plan and visits around. And once that has been established, and it could be something as simple as to be happy and to be able to get out of my house, or it could be to have a job, to get my home back. It could be something more long-term. So the long-term ones usually take a little bit longer to reach because of the fact that they take many steps. So the treatment plan is for 6 months, and then we update it, revise it, change it as needed, and I meet with the client. That's what our goal is, to meet once, twice, or 3 times a week to work on these goals.
And where do you meet the client?
If they're living in an apartment, we meet them at their apartment or in their home, or they may be living at a board and lodge, a residential facility of some sort. They could be living at the Twin Towers, Pickett Place. A lot of people have difficulty with finances, so they live in areas that are subsidized.
Sure. Okay, so you meet with them 2 or 3 times a week, and you establish these goals. And give us an example of 2 goals, 2 intermediate goals, or 2 beginning goals. Once you, what would?
Okay. Many times a goal is to get into better shape. And that would be because they have low self-esteem, so they're not feeling like they can apply for a job. A lot of times the medication has had them put on weight for different reasons, and that's a problem with many people. And so to get them to the point where they can lose weight and get out and exercise can maybe help them improve their chances of getting a job.
Sure. And would you start right in with a group activity, or do they start with individual activity and gradually move to group activities to help them along?
Yeah, I think it depends on the individual and how.
Okay.
Some individuals, like some that I can think of that I have, it's very difficult to get them to go to a group activity because of their maybe their paranoias or their fear of groups, or just getting out in general is difficult.
The reason I ask that is I assume you see several clients that have similar needs. So I imagine you have group activities that are serving more than one person at a time to try to help them.
We try to group it according to who we think will fit that particular group. And you know, there are certain people that you know would not do well in this environment, so you don't even go there. But and I am starting a new group soon, and there's a lot of people that are a little bit afraid, but I'm trying to coax them and make it as as comfortable for them as possible, so that they can experience something new and different that they haven't tried before.
So you meet with them 2 to 3 times a week individually, one-on-one. But aside from that, how often would you say you're meeting with each client? Do you see them daily or not?
No.
Okay.
If I might run into them because I see them at the board and lodge, but other than that, maximum 3 times a week.
Okay.
And if I see them in a group, then that's another one.
Is someone following up on their physical activity or the things that how do you know that they're doing it, or how?
Well, we try to include the people that are important to them in their lives, and include them as well in following through.
Great.
Whether it's them, their case manager, their whoever they live with.
Sure. Okay. And we've mentioned the Board and Lodge several times. Gary, could you tell us a little bit about what that is?
West Park Board and Lodge is a 10-bed state licensed facility for individuals who basically need a roof over their head and 3 meals a day, along with nutritious snacks that we provide. That's pretty much it. It's more or less like a hotel. People do not need the supervision. They do it at other levels of residential care.
And what's the maximum length of stay there?
There's no set determined time. As long as the individual is in need, they can stay there. And
okay.
That's it.
So if someone walks up to you from off the street and says, "Can I stay at your board and lodge?" and they stay there one day and they have no case manager and they have no connections for funding reasons, what happens with them? What do you recommend?
All this is based on need. Ordinarily, there is a need for a case manager or a social worker to get involved in part to provide the funding stream. However, we have had individuals pay entirely their own way, and they had no need of that. That's kind of the key to a lot of these services is that they are individualized. Now, Ann has said she doesn't see anybody more than 3 days a week, but we have had individuals probably prior to her coming on board that we saw daily. And that's what we try to do, and that's what we're required to do, really, is individualize the services and see that they get their needs met. And that's really the focus of all this.
So is it safe to say that someone who comes to the Board and Lodge and is now set up with a case manager and kind of has a plan, is it safe to say that you are almost encouraging them to move to the next step or to the appropriate facility, or trying to move them along?
That would be the goal as possible, and like again, it all boils down to the individual. If that person is capable of moving into their own apartment and getting by with services for a while, and then eventually without services, that definitely would be the goal. But it all depends on that individual. We're there to provide the support we can through both at the residence itself and then through the arms and case management. And there's a lot of individuals out there in the community and professional level who are working towards the same goal.
That's wonderful. Tell me about who would be a prime candidate for adult foster care.
Again, an individual in need of a place to live, probably in need of some medication management, who wasn't able to manage those aspects of their life themselves so well. The key to adult foster care, the way we operate it, is it's 24-hour-a-day supervision.
Okay.
So if a person, and that doesn't mean that they're have to be watched all the time. That again is individualized. We have people who can go out in the community and come home at night and pretty much take care of their needs. But
and how long are they generally in adult foster care?
That again varies to need.
Okay. If someone, what I should have asked is if someone leaves adult foster care, if they graduate from adult foster care, where do they go? Where do they, generally speaking?
They could go to a board and lodge if that makes the most sense. Sometimes they graduate back to their own home. Or,
Okay, independent living again is the
yeah,
goal.
yeah.
Okay. If we refer back to individualized care, let's walk through a typical day at ARMS. Anne, would you like to start?
Sure.
with that?
Typically the day will start with an ARMS practitioner like myself going to the office, which is at West Park Board and Lodge. That's where all of the files are that we have for each of one of our clients. And everything's under lock and key, and some of our clients have to have their medications stored there as well because they have had difficulties keeping them in their home for
Sure.
different reasons. So we get what we need for the day there, and take our files with us, take our medications with us, and take our cars, go to the individual's home or where they may want to meet. Sometimes we have clients who like to meet somewhere else, so we'll meet in the community, maybe at McDonald's or something where there's other people. Unless it's something where we have to discuss a lot of confidential information, then we don't. And we meet with the individual, and we usually have a plan that's already been set from the week before so that we have something that we're working on. And I typically will call them when I'm on the way and let them know I'm coming in. We may be planning to work on our goal of medication monitoring first. So we go into the apartment and I assist them with setting up their meds, helping them develop their own system so that they can eventually do this on their own. And once that's finished, typically we work on whatever it is the goal we were working on at that time. For some people it might be learning how to use a computer better because they want to be able to have a job and they know their computer skills are low and they're afraid of big classes and too much stimulation in the environment, so they work one-on-one with me. And so we'll work on computer skills, or a person might be trying to get used to the transportation system in the town because they're new to Austin.
Sure.
So we may have to teach them how to use the bus system.
And I imagine at some point, especially early on, if these people have really suffered prior to when you meet up with them, that they might have difficulty cooking for themselves or going grocery shopping. How do you treat that situation?
That is another area they can work on as part of their goals, and those are healthy lifestyle skills, and it's a part of one of the areas that we can work on. So, and that's essential to living independently, is to be able to cook and clean for yourself, shop for yourself. So we may have to take baby steps and just get them out to the store. They may need a lot of help navigating around, and we just have to remind them where they're at. If they have a mental illness that has them very paranoid, that is especially difficult. So it might not be a very long shopping trip, or it might be cut short, but we got it done. We got out, and they were able to talk to the cashier. And those are maybe it's nothing to us. We do it every day, but to someone who's experiencing a lot of things inside their head, we don't know what that's like.
Sure.
For them. And
Sure.
so for them, getting out and going to the grocery store is a very big deal.
Sure. And Gary, what about your other facilities such as adult foster care and assisted living? Are grocery services and companions to different destinations in town, are those available for residents in those facilities?
We do provide transportation pretty much to any event in the community. We take individual shopping once or twice a week as needed. So the whole idea is to become a part of the community, and transportation is definitely a part of that.
So you provide your own transportation for those?
Yes.
And then, as you said, that with the ARMS program, you're encouraging them to use the transportation that's already established within the city. Gary, let me go revert back to this. What was it that you saw? What occurred? What occurred that established this need in your mind? What occurred where you said, Austin really needs a service like this? I need to start this. What happened to make you decide that?
And as far as the residential?
Well, whatever you started with.
I started with case
Case
management.
right.
That was simply the Mower County deciding to offer that under a contract basis, and I happen to be, I believe, the first first in the community back in 1994 to get a contract to perform
And
case
had you been
management.
performing these services prior to that, or did you?
No, I was actually in workers' comp prior to that. I just had an interest in this, and
So
it
you
was
established
kind of a
your
career
company
switch.
at that point?
In 1994, right.
Wonderful.
Yeah.
And Mower County's been contracting with you ever since?
Yes.
That's wonderful. You're successful right off the bat. And from there, you started with case management, and it grew. What was your next step?
I guess the next step would have been an evolution into the community. It was called outreach at the time, which is now called ARMS, but that situation became available, and I guess you'd say I took advantage of it and hired some people who I knew would be able to perform that, working with individuals with a mental illness in the community. And after a couple of years of the outreach program, the state offered ARMS, which made more sense, and then we became state certified to do that. At some point in there, and I'm not sure of the year, I think it was 2003, West Park Board and Lodge became available. It was previously had been called Agape. It was a treatment facility for adolescents for many years, and they just were no longer able to stay in business. So I bought that property and the one next to it, and I saw a need in the community for a residential board and lodge for individuals with a mental illness.
I'm sorry.
And that eventually evolved after a couple of years into using the house next door for the adult foster care. Mm-hmm. And then the Reflections Assisted Living just came a couple of years after that. We just decided we need to expand into that. So we have kind of ran the gamut of where we saw the need.
Okay. And how have you seen the population and mental health services within the population change since 1994?
That's a tough question.
Has it migrated in any one direction? Or are they the same? Are there more individuals in need?
I can't say that I see that. But the only difference I would see would be that seems to be more need for treatment, and there's more drug use out there, which exacerbates the standing mental illness symptoms. So.
Do you feel the need to go to the doctor with clients? Are you hearing the accurate story? Mm-hmm. You know, when a person goes to the doctor by themselves and comes back and maybe they have trouble controlling their medications, do they come back and tell you the truth, or do you feel like you need to go with them to make sure that that everybody has the story straight?
I guess as a case manager, I try to go to all my psychiatry appointments with my clients. So I'm on the same page as the doctor, and we're both following through with what the doctor's ordering the client to do.
Good.
And so there may be a blood test that they can take, and they can see if the client's not taking the medications. Mm-hmm. So,
or taking too many.
Yes, exactly.
Right. So you have quite a partnership. Who else would be involved in your partnership? Doctors, psychiatrists. I mean, just general medical doctors, psychiatrists. Who else is
Therapist.
in that? Therapists. Sure.
Counselors. That may be seen.
Supportive employment, Cedar Valley.
Sure, and just
very important if they're wanting to work, because most of them can't hold jobs. I mean, they can once they get on their medications.
With support, they can.
With support, most of them, but have had a history of not being able to hold a job because of their symptoms worsening. So Cedar Valley is really key in that independence and having them be able to live on their own and stuff, and just having a normal routine.
And where does the majority of the funding come from as far as these people that you're seeing at the board and lodge? Let's just start at that level.
Okay, all our clients are in the community are under medical assistance. That doesn't play into the residential so much. There is government funding out there which is called group residential housing, which is a combination of local, state, and federal dollars that if the individual is in need, that they will support that. Most of our clients, residents, are under Social Security. They get an income, and so a portion of that would be used. Sometimes, if they make quite a bit of money, then they would pay all of that themselves. But,
Are you concerned with what will happen in the near future concerning state and federal dollars? Are you
it
concerned
is a
with people
concern.
being turned away that really need your services?
Yeah, it is a concern, and we're
It's
not.
already
I'm just
happening,
not understanding of it
Yeah.
that much at this point. But what I'm thinking may happen, and I guess I've been told, is that maybe the federal dollars will start to pour in, even though the state dollars are dropping off, and maybe we can keep most of the services going. That's our hope.
Okay.
Going back to where the cuts came in, I know, Gary, you're seeing it on the housing side of it. Me as a case manager, let's say I have a client who has entered a hospital. They may have lost their previous home. Let's say they were living in Gary's adult foster care. Let's say they go to the hospital and they're in there for 2 months. They're going to lose that bed.
Sure.
And finding it's called a caddy waiver, which is county funds, to put them back into another adult foster care is really difficult because there's only so many slots. So finding that funding and that piece has been really difficult.
Yeah.
As far as the case management side, I think.
I bet it is.
That's
So-
tight.
We just have a short time left, and I want to talk about some new initiatives that you're working on.
That would be, we were asked by the county, I believe it was kind of the beginning of this year, the end of last, to take over the management of the Bridge Drop-In Center that's located on the boardwalk in downtown Austin. That's a agency basically started by and run by consumers, one of the few organizations in the state that is run by consumers, and they were doing a good job. They just needed an organization to do the basic management, to see that the payroll got done, and a few odds and ends things, and the county asked my company to do that, so we stepped in under Quality Community Services and basically run the payroll for the folks, and again they do a good job of managing things pretty well themselves. So that is available for basically anybody in the community, but it was designed for people if they need some support. It's a good place to be.
That concludes tonight's episode. Thank you all for joining us and enlightening us on the mental health services in the Austin area. Stay tuned next week for Health Connections. Thank you and have a good night.